We're exploring at present different ways of providing general medical services to our population. So some of the ways we're looking is how we could enable practices come together and work as federations, or how we could take away some of the administrative burden that general practice faces and centralise that.
We have some great examples already where our GPs, our local hospitals, our community nurses and social care are all working together. So if you went, for example, to somewhere like Llandovery, where we have a GP practice right next door to a community hospital, they're able to offer within that community something which covers all of the care and health needs for that local population, working as a team.
So we work in clusters. We have groups of GP practices, anything from 5 to 8 GP practices working together as a cluster, and we pull into that cluster other parts of our health board and other essential stakeholders, representatives from our community, professionals from our local authorities, so for social care, and we have fantastic third sector brokers who know everything there is to know about the local charitable and third sector organisations.
Being a GP in Llanelli is quite nice because the rest of the GPs are also very pleasant people. We all get along, the cluster functions well, we work well together professionally. We've got a good working relationship with the local consultants. They're all very supportive, very amenable, very approachable. We also have a close relationship with the local social services. We have regular meetings with our MDTs where we consult with social services, the local physiotherapists, district nurses. We all get together and discuss our more complex patients.
Well, I've been working as GP lead for the Health Board now for several years, and over this time I think we've seen an evolution of what we call cluster working, and that just means practices getting together to try and look at our population needs and to try and suggest and develop services, working with the Health Board and our community services and our specialist colleagues.
Working in clusters, groups of practices working together, I think is going to be a useful thing for sustaining general practice over the future in the area, for developing services. That's quite exciting, and the local health board are very much driving this forward, and with support from us, and they are supportive equally of us.
So in addition to my primary role of delivering ambulance services across the 2 health board areas, we also look to support primary care. It's been recognised that there are pressures in primary care, and our ability to work across professional boundaries is key to supporting GPs and the development of GP practice.
For this process.
We work very closely with our district nurses, and we will be more and more working with social services and managing budgets for our local populations as well.
We have, as part of that cluster working, a particular budget, so those clusters of frontline clinicians can actually start investing in services and pump priming services that they know locally will really benefit their population. And as a health board, we pretty much try and keep our hands away from that and devolve as much decision making and responsibility down to the clusters, down to our local communities, so that we're actually really responsive to our population and to the clinicians that deliver the care there.